the morning show.
Yeah.
The Big Show with Glenn and Angel on Kiss 92.
Good morning.
Sometimes getting out of bed in the morning is a lot to deal with all at once.
We are live on Facebook, we are live on YouTube, and we are live over the airwaves as well. It's Good Morning Doctor Day, and we welcome to the Big Show studio Gastroenterologist from Gleneagles Hospital, Dr Bhavesh Doshi.
Thank you.
As well as General Surgeon from Gleneagles Hospital, Dr Tan Ek Khoon. Dr Tan, Dr Doshi, good morning.
Good morning.
Good morning, gentlemen. Thanks so much for coming into the studio. We know you're very, very busy doctors that are always needed in the hospital. But today we want to talk about pancreatic health. I think maybe not enough people understand what exactly pancreatic health is. And we're going to be covering as much as we can, but from early inflammation to surgery. So let's first talk about the pancreas. What does it do? Well, maybe we'll talk to the gastroenterologist, Dr. Doshi, about this.
And where is it?
Okay, so the pancreas is a very important organ in the body. It has two main functions. It has exocrine functions, which means it secretes enzymes to help you digest your food. And that's a vital function in itself. It also has an endocrine function, which means it secretes hormones in your body to actually help you regulate your sugar levels. So things like insulin and glucagon are secreted by the pancreas. So these are two vital functions.
It sounds important then.
So would you say like someone who has diabetes, let's say,
Yes.
has probably got a problem with their pancreas?
Yes, oftentimes it's a combination of reduced secretion of insulin, but also insulin resistance in the body. So a lack of action of insulin in the body.
Where exactly is the pancreas
That's
in relation to our body?
A great question, actually. The pancreas sits so deep in the body, it sits right behind the stomach. So it's right at the back end of the abdomen.
Okay. So what kind of pancreas-related issues do you see here in Singapore then?
Dr Tan?
So in my practice, most of the pancreatic-related conditions that I see are those related to growths, whether it be a cyst or a tumor. So these are the most common conditions that we see that I have to follow up on.
This inside or outside and around the
that
pancreas?
would be, so these either growths would be inside the pancreas. So structural changes.
Okay.
Now, Dr. Doshi, what kind of symptoms should we be looking out for, when it comes to the pancreas, for us to be concerned?
Yeah. So because pancreas has so many roles in the body, the symptoms can vary depending on the condition that's affecting the pancreas. So the common conditions that occur in the pancreas are acute pancreatitis, which is acute inflammation of the pancreas. Now, that is virtually never silent. You would have significant symptoms. You would have severe pain in your abdomen, radiating to your back. It would often feel like a sharp stabbing pain, like a knife going in. So that's acute pancreatitis. Now, there are pancreatic cancers, which Dr. Tan has alluded to, and pancreatic cysts, which are often asymptomatic. So patients may not experience any symptoms until there is significant growth.
Okay. So we just got to look out for pains or get checks, I guess?
Yes.
Yeah, okay.
All right. Let's continue to talk to the doctors on the Big Show TV. Up next, Flower of Love. This is breaking news on Kiss 92.
So, Dr. Tan, I guess I can ask, like, at what point do we start to worry? Because, when we get a pain in our pancreas, do we sometimes mistake it for, say, a pain in our stomach or a pain somewhere else, Like, when do we start to go and see a doctor?
Yeah, you're right. That's a very pertinent question. I would say that if there's pain that doesn't go away or it continues to get worse over a day or two, that's probably when you should start looking for medical attention. The truth of the matter is the pancreatic conditions are actually almost very silent. And that's why oftentimes when it ends up with things like cancer, it usually presents very late because the patients have left it unmonitored for a very long time. So I would say once you start to have some symptoms and it doesn't seem to go away, you should get it checked out just to make sure it's not something bad.
But if it's so silent, then should we be doing regular checks on our pancreas? Like you say, the growths and all that, sometimes they're asymptomatic, right? It could be sitting there until it's too late. But should we be doing health checks or do health checks cover it?
So right now, there is no recommendation worldwide for pancreatic screening. So meaning that even if you were to do certain blood tests, given that pancreatic illnesses are generally quite rare compared to the other big cancers that people face. So there's no recommendation for screening either with blood tests or with imaging.
Yeah, so this is very tricky then, because as you mentioned, Dr. Doshi, earlier on, it's either you're in extreme pain or it's
No
asymptomatic.
pain, yeah.
Yes, exactly.
Yeah, and if you want to check for everything, that's it. You know, I mean, it'll take forever. I mean, we all go for our yearly checkups already.
Yeah.
But if we go for our yearly checkups and we want to include like a test for our
Can we?
pancreas, is that okay? How do we do that?
So currently there are some tests available with health screening. So cancer markers are one of those. Unfortunately, cancer markers are a highly inaccurate way of detecting pancreatic cancer. So if at best case, it has an accuracy of about 60 to 80% at best case. So at the moment, as Dr. Tan said, there isn't a good enough screening protocol. There are some recommendations internationally in patients who have genetic conditions that predispose them to cancer, particularly pancreatic cancer, certain genetic mutations that they might carry. For these individuals, there are some recommendations for screening, but for the average individual, there isn't a recommendation for screening. So whether you do cancer markers or not, it's really a personal choice. It's not really science-based.
Right.
So we talk about the growths that you mentioned earlier, the cysts and stuff like that. Is it let's talk about inflammation. Once the pancreas is inflamed or in trouble, is that the sharp pain that we feel, or where's that coming from?
Yeah, so if you're talking about acute pancreatitis, when patients develop acute severe inflammation of the pancreas, that is the symptom that they present with. But like we said, the patients can have other conditions, chronic pancreatitis, for instance, where they may experience no symptoms whatsoever. It's a situation where they get chronic inflammation in the pancreas, causing scarring of the pancreas. So there are different conditions and they do present very differently.
Is there a cure? I mean, can this be reversed, the inflammation, the cysts?
Well, it depends on what is triggering off the inflammation. For acute pancreatitis, generally we are thinking in our population, the most common trigger is actually gallstones. So sometimes patients will develop or grow gallstones in their gallbladder, and if these can sometimes drop out or the sludge drops out, it may trigger off the pancreas and cause an irritative effect. So the next other big trigger for pancreatitis, acute pancreatitis, is actually alcohol use. So there are patients which you may have heard that have a binge drinking, and then they.
Did you say binge drinking?
I did, yeah. So and then they end up having it irritates the pancreas. So other medications could do the same. Some patients have genetic conditions that cause their component of their cholesterol to be exceedingly high, and that can also irritate the pancreas. So repeated episodes of irritation will lead to chronic pancreatitis as well. So that's generally when you feel all these symptoms of pain, or every time you eat, or after you eat, or whenever you have a fatty meal.
Thank goodness it doesn't apply to me. She's always looking at me when it comes to alcohol. But alcohol is
Can
not
you
like
blame me?
has not irritated my pancreas or my system. So
for someone like
That's
Glenn,
fine.
who wants to live that lifestyle, I mean, I'm just saying, because there are a lot of people who enjoy a drink, whether it's every day or binge drinking, because a lot of people go out on the weekends and they binge drink as well. How do they make sure that they keep their pancreas healthy or in best shape? Not just asking for a friend.
So, look, we have to enjoy life. So there's always a balance, and I think it's moderation. So moderation is a key word. So alcohol is one aspect of it. So try to limit the amount of alcohol that you drink. It's not no alcohol. It's just small quantities of alcohol, and not as frequently as we should be doing, or as we are doing. But the other thing that's not mentioned often is smoking. So the
really?
perception was that it was purely alcohol that would trigger pancreatic diseases. But nowadays we're realizing, and I've seen it in my clinic, patients who've come in who don't drink any alcohol, who develop severe pancreatic symptoms, and it's oftentimes related back to smoking. So all we do is ask them to stop smoking. easier said than done. But when they do get around to it, it does improve their pancreatic symptoms significantly.
Without doing anything else, just the smoking.
doing anything else.
Just the quitting of smoking.
One thing's for sure, I'm not going to live till 120, that's for sure. Okay, we're going to go back on air.
Kiss 92 traffic.
Okay, taking a look at the situation on the road on Queensway, the AYE at the Queensway underpass, avoid lane 2, an accident has been spotted. Other than that, it's the usual peak hour traffic that you're used to. If you spot anything else, you can WhatsApp us 885550
Welcome back to The Big Show and The Big Show TV. Our guests for this morning are Dr. Bhavesh Doshi, gastroenterologist from Gleneagles Hospital, as well as Dr. Tan Ek Khoon, who's a general surgeon at Gleneagles Hospital.
So we have a couple of viewers online that are asking this question. Is it true that pancreatic cancer is very fatal? And your chances of survival are very slim. We've had 2 people saying this. Is that true, Dr. Tan?
Well, in general, yes. If you compare, every type of cancer has a different biological behavior. I would say that pancreatic cancer is one of those that we consider lethal cancer. It means it's more likely to end up with a patient dying from it. So that said, there has been a lot of advances in the last decade or so, primarily with the development of new types of medications, both chemotherapy as well as immunotherapy, as well as surgical techniques that have allowed better long-term outcomes, even if you get detected with pancreatic cancer.
Okay.
So there is some hope, I would say.
Okay, that's good. What about when it comes to diet for the pancreas? What kind of foods are we looking at?
Yep. So I think, again, it's the standard advice, fresh fruit, vegetables, healthy lifestyle, avoiding alcohol.
Everything in moderation.
Everything in moderation, that's right. But essentially avoiding processed foods, red meats, and just fresh fruits.
Okay.
Yeah.
Oh my God.
My plant-based diet, I'm telling you. I keep saying.
Which is why I'm saying every week when, when we have you doctors on and all that, I kind of like feel the symptoms of what we're talking about. Like I came in this morning. Yeah, I came in this morning. I told her already, I'm like, my tummy's not feeling too good, because I was out late last night drinking, and right after that I had supper and I had like a really spicy bowl of noodles, and I went to sleep, and I woke up this morning and my tummy wasn't feeling too comfortable. I'm like, man, aren't we talking about the pancreas this morning on Good Morning Doctor? Exactly what I said yesterday, you see?
And last week we were talking about varicose veins, and he went home checking his legs.
I'm like, oh my goodness, I feel... And when we had a cardiologist, same thing. I went home, I'm like, I think my heart's beating really fast. It's like, have you guys heard of things like this? Like sometimes it plays on people's minds.
Yes, of course. I mean, it's somatic, psychosomatic. So, if you're thinking about these things, you might experience those symptoms. It's natural, completely natural.
Okay, you're normal. Don't worry, you're not that special.
Which
okay?
means you're abnormal because you don't feel anything. Okay, let's continue to talk to the doctors on The Big Show TV. It's 8:19.
Kiss 92 Time Check, brought to you by...
So how much... how many people do you see on average? I mean, is it a high number of people that have pancreatic issues here in Singapore? Is it something that we should be worried about, or?
So when it comes to things like pancreatic cysts, particularly, I think it's a burgeoning problem in the last 20, 30 years, because imaging has improved, and we are starting to see more and more cysts, or rather the technology has allowed us to detect more and more of these cysts early, and patients are getting a variety of scans for various reasons as well. There's increased access to healthcare. So we're starting to pick up a lot of these cysts, and a lot of patients don't really know where that leads to. So some of these cysts, not all these cysts are pre-malignant, meaning they can lead to cancer, but some do. So it's important to actually find out which type of cyst you have and have the necessary follow-up to try to prevent yourself from developing cancer if you are at risk.
Okay.
Okay. So, I mean, let's touch on that whole, when it develops into cancer once again. I mean, this is a very dangerous cancer. I know you were, saying, there's some hope and stuff like that. But I think I've spoken to some people regarding pancreatic cancer, and it is most of the time fatal.
No, absolutely. So, 35 years ago, when I was a medical student, the survival rates for pancreatic cancer at 5 years was about 6%.
Wow.
We now have improved survival, but it's not that much better. It's about 12%. So
oh, wow. Okay.
the only cure for cancer of the pancreas is surgery. But the only situation where surgery is effective is if we detect the cancer early enough. So if it's small, if it's an early lesion, and particularly if it's located in a location within the pancreas that is easier to get to, that offers the best chance of survival.
Because I got a friend I play golf with, and he had pancreatic cancer, and he was given almost no chance. But he survived.
Wow.
And I think he's gone down in history as one of the very few, one or two people who actually defied the odds.
Did he get surgery or chemo or immunotherapy?
He did get surgery.
He did get surgery.
Yeah,
okay.
he still has, the scars to,
I know you mentioned that pancreatic checks are not mandatory, or they're not included in your main health checks every year. So, is there any sort of group of people that should be checking their pancreas? Kind of those. Is it hereditary? Is it a lifestyle based? Where you recommend that people do get their pancreas checked?
Yeah. So, great question. So, the current recommendations, these are international recommendations, are that people who have genetic mutations such as BRCA1, BRCA2 gene mutations, they should undergo surveillance, some sort of surveillance, but it's not very clear what type of surveillance. So, blood tests, as I mentioned, they're not that accurate. Imaging is an option, but there isn't a standard set of guidelines that tells you that you should do an MRI or a CT or endoscopic ultrasound. There isn't a very firm sort of recommendation because the evidence is scanty. So at the moment, anyone who has lifestyle risk factors, there is no recommendation for screening for those individuals.
Okay.
Right. So it's the usual things, right? I mean, to keep ourselves healthy, we don't
eat,
drink,
stay active, don't smoke.
Well, we didn't cover the part where we talk about staying active.
Yeah.
Is exercise, etc., good for this condition?
Absolutely. So obesity is another risk factor for pancreatic cancer, for pancreatitis. So there's plenty of evidence to say that having a healthy lifestyle, plenty of exercise, actually improves or reduces the risk of pancreatic pathology.
Week in and week out, the doctors say this to us. It's like stay active, make sure you eat well, don't drink so much, definitely don't smoke, and just live an overall healthy lifestyle.
Right.
It's every week we get that.
Got a question here from Winnie. If I had my gallbladder removed, am I at a higher risk of affecting my pancreas in the long term?
No.
It's the opposite.
The opposite, because you won't have gallstones, right?
Yeah, most of the stones that a patient has are formed in the gallbladder. So once the gallbladder is removed, you actually have
one less
storage. Yeah.
Okay.
So we should all have our gallbladders removed.
Do we need our gallbladders? Because there's certain things that we don't need, right?
I would not recommend removing it if you don't need to have it removed.
Okay, but you can live without it.
Yes.
Okay.
But
so maybe we should remove it.
No, that would not be recommended.
It's not exactly a tonsil,
No, I know, but like tonsil, appendicitis, these are all like leftover from God knows when, right? Which we don't need,
They're
right?
not vital organs.
So is the gallbladder vital?
No, it's not vital.
But still no recommendation removing it. Okay.
Why? What happens? Why?
Yeah, why wouldn't you recommend removing it?
It's just surgery that you don't need.
Oh, right. Okay, because you go under.
Even if the risk is so low, it's risk that you don't need. And so if your gallbladder is healthy, I would not recommend surgery for you.
Okay, fair enough.
But coming back to the pancreas, I just want to throw one thing in real quick about symptoms that oftentimes we talk about pain and all that. Something that's quite interesting is actually what we call new onset diabetes.
What is that?
So if all of a sudden you start to notice that you have diabetes, or if you do already have diabetes and it suddenly gets much worse, sometimes that is also another subtle sign that of a pancreatic growth.
Oh.
So it's probably something worthwhile for the listeners to
pay attention to. Okay, okay. So diabetics are at higher risk.
Certain individuals who have diabetes, who are not improving with their diabetic treatment, may need follow-up. And likewise, patients who present with gastric symptoms, because remember, the pancreas is sitting right behind the stomach. So it mimics symptoms of the stomach. So it mimics gastritis, mimics symptoms of acid in the stomach.
Right.
So patients who've had either diabetes or gastric symptoms, who've had treatment for that and are not improving, but particularly if they're continuing to lose weight, they should have further investigations.
Okay.
Do you notice that many people have stomach issues these days, Doctor?
It's such
Why
a,
is
it's
that,
such
though?
a common it's such a common condition. I mean, I think it's a combination of things. You know, it's our lifestyle, it's our lack of physical activity, sedentary lifestyles. All of those things contribute towards gastric symptoms or colonic symptoms or even pancreatic symptoms. So we are seeing a lot of it. And unfortunately, I mean, if you look at the data for pancreatic cancer per se compared to any of the other GI cancers, all the other cancer incidence rates are slowly stabilizing or dropping, particularly in over 50s, in older age groups. But pancreatic cancer is still rising.
Okay, I was going to ask: is there a common age group for pancreatic cancer? Are children at risk?
Exceedingly rare for children to get pancreatic cancer, unless they have genetic mutations that
like what you
might
were saying.
predispose to them. So typically not children, but younger age group.
Okay, like teens and young adults.
Yeah, young adults.
Okay,
yeah.
all right.
Yeah.
Okay, we're going back on air one last time.
Kiss 92 traffic.
Lots of slow traffic all over the place. It is the thick of peak hour right now at 8:27, but also on Queensway, at the Queensway underpass, avoid lane 2, an accident. Wherever you are, if you spot anything at all, please share that information with us. 8855509220.
Welcome back to The Big Show and The Big Show TV. We've been speaking to Dr. Bhavesh Doshi as well as Dr. Khoon from Gleneagles Hospital. And today we are discussing pancreatic health. And it's good to have had the both of you in the studio today because I think, we've been enlightened
Absolutely.
about this condition.
So you mentioned things like, staying active, obviously a good diet, quit smoking, moderation with alcohol.
Don't eat too much processed food.
What about things like stress? Does that affect the pancreas? Because you mentioned something about the acidity as well. And usually when people feel stressed, you get some sort of like tummy upset and you feel a little less comfortable.
Yeah. So I think, stress goes hand in hand with those other risk factors we talked about with the unhealthy lifestyle. So it is linked, even if it's indirect, it is linked. Yes.
Okay.
Too much of everything is...
It's not a good thing.
Too much sex. Will it affect my pancreas?
I'm not an expert in that.
there's no data on that.
No data on that.
Not yet. You wanna be part of the
Means
study?
it's all right. Okay, thank you so much, doctors, for coming in. Any last words before we let you go?
I guess the message here is that we're working hard to solve pancreatic problems. They're on the rise, but we're actively sort of treating it and managing it. Yeah.
Okay.
Dr.
Dr.
Tan?
Tan?
Yeah, similarly, I just want to say that I think with advances in technology, imaging, honestly, the truth is we are starting to catch more of these cancers earlier. And with the better medications, we're actually starting to move some of those advanced cancers with chemotherapy into what we call resectable or slightly smaller tumors. And then at that point in time, they are amenable to surgery, which is still the mainstay of treatment.
Okay. So that's good. It's slowly but surely we're getting there to sort of reduce the numbers for pancreatic cancer. Okay.
All right. Thank you so much, Dr.
Thank you.
Doshi.
Thank you.
Thank you so much,
you.
Dr. Tan.
Thank you so much.
For more insights or to replay today's segment, the full episode is now available on
All right, you're listening to Duffy right now. That's playing Mercy on Kiss 92. All the great songs in one place. We have our second guest for today, and he is the Senior Vice President for Communications and Corporate Affairs for Marina Bay Sands. We love Marina Bay Sands.
We
by the
do.
way.
Thank you very much.
Nick is in the house. Nicholas Ionides.
Good morning, Nick.
Did I do that okay?
You did that perfectly.
Perfectly, right?
yes.
It must help that I
Glenn,
put the
right?
phonetics in there.
Very good morning to everyone.
Good morning,
Nick. It's so good to have you here. So you're here because you've got something really special going on. There's something called Sands for Singapore Charity Festival, and you guys are partnering with the Community Chest. Tell us a little bit more about this initiative and what else you guys are doing.
All right. Well, thanks so much for having me on. The Sands for Singapore Charity Festival is something that we've been doing for more than a decade now. This will be the 11th installment of it. Last year was our big 10th anniversary. So we had 10 weeks of volunteering activities by our staff and many other activities, all culminating in the Sands for Singapore Charity Festival itself at the Event Plaza. This year will be the 11th installment, and of course it's the SG60 year, so lots of SG60 activities related to it. And it will be over the 5th, 6th, and 7th of September at the Event Plaza at Marina Bay Sands. So free for entry. It's basically a fantastic vibe on the Event Plaza. You've got entertainment, you've got great food. It's fun for kids. But in addition, it's about educating us about people who are more in need in Singapore. We all, I think, take for granted at times that we are in such a wealthy society here, that there are people who are in need. So the Sands for Singapore Charity Festival is about fun. It's about fundraising as well, but it's also about education. So we have representatives of organizations that do good in society. We also have 16 nonprofits selling some of their items for their fundraising activities. We give them the space, and then they can sell their wares, and it's fantastic for everybody.
So it's
Right.
not just the Community Chest that you're working with.
We work with many organizations, including Community Chest. The timing, specifically with Community Chest, we have what's called the Heartstrings Walk. This is an annual non-competitive walk around the Marina Bay area. That will be taking place on Saturday the 6th in the late afternoon, evening.
Oh, nice.
But that morning as well, what's fun is we do a thing called the Vertical Marathon, where we climb 57 flights of
Oh my
stairs.
gosh,
I've
the
always
whole of
wanted to do
the
that.
whole of
Join me.
Marina
I'm
Bay
going tomorrow
Sands.
again.
Oh my God, he's going tomorrow. There you go.
Tomorrow?
I'm in training right now.
He's in
so,
Oh, I see.
How hard is it? Okay.
I like to let people think it's really, really hard. But it's mostly a mental game to be able to climb those 57 stories.
Wow,
But,
so it sounds like you've got it covered then.
yeah, I do have
Okay.
home court advantage.
Okay, yeah, that's true. That's true.
You know, I just did a Batu Caves climb, actually.
How many
wow.
stairs were there?
It was, I think, 257
Okay.
steps or something like that.
And how many
It
stairs
was so
do you know?
good.
Wow, fantastic.
Your 57 floors is how
57
many
floors.
stairs? Do you know?
I think much more than that, I
Tomorrow
think.
night I
It's
will
like times
count.
10 or 10 or something, you know?
Yeah.
Because each flight is about 10, 12 staircase, right? About that.
Maybe a little bit more than that, but close to it. Yeah.
Okay, then times that by 57.
Exactly.
Oh my goodness.
No, it was so good. It was so satisfying, though, and I'm sure you feel the same way.
Of
Do you take a
course.
lift back down, or do you walk down?
I take a lift back.
Yeah, your knees at the end of it are going to be quite soft, right?
Yeah, absolutely. Your legs are like jello. After
Yeah,
it, so.
yeah. Tell us how can people get involved with, say, climbing, doing the vertical marathon, doing the horizontal marathon,
And donating.
Yeah.
Well, the Heartstrings Walk around the Marina Bay area is through Community Chest that public can sign up for as well. The vertical marathon also, more corporates tend to be involved in that. So you have teams of 4. It does, I'm not sure if it's at capacity yet, but it should be pretty close to it if it's not.
Okay.
But that is a competitive climb. Our police force people, the Gurkhas, tend
This-
to do very,
to
very
win.
well. They make us look really bad. But
Okay.
yeah.
So if people want to also, say, put some money in to donate to the causes, how can they do that?
They can do so, of course, through Community Chest.
Okay.
At the Sands for Singapore Charity Festival itself over the 5th, 6th, and 7th, we have what we call a giving marketplace. So there'll be 16 nonprofits who are selling some of their items. We give them the space and they're able to sell those goods. So last year, for example, my wife and I picked up quite a few items that we're using as gifts.
It's very tempting.
Oh, they're fantastic
Yeah.
items. Things like key rings, things like pouches, and it makes for great gifts. So, you can be educated when you're there. You can also pick up some things for yourself. And it's great fun for the family over the festival days. The entertainment that we have, the food and beverage, and all proceeds will be going to charity. organizations.
Okay, I'll be
that's
there
fantastic.
this year for sure.
5th
I'm
to
gonna
7th
get
September.
Christmas presents already.
I know it's great for gifting because by the time September rolls around, we're like 3 months away from Christmas. Okay, let's talk about the Sweet Collective
I
when
think
we go
let's
on
go
air.
on air, yeah.
When we go on
And
air,
talk about that.
and then we can talk a little bit more.
Yeah, and the beneficiaries as well. Once again.
Sure.
And the restaurants, yeah.
This is a good festival, man.
So you say the event plaza, that's right under where the fountain is,
Yeah,
right?
the bowl.
Or the
Yeah.
bowl is.
Yeah, correct.
I'm not sure what it's called.
It's called
but
the Rainoculus.
the Rainoculus,
And
that's the
outside
one.
there where we have Spectra, the light and water show every evening.
Okay. And the time of the festival?
5 p.m. to 11 p.m.
Oh, it's only in the evening, which
Yeah,
is
we,
great.
We had it in the past starting earlier at 2 p.m., but it tends to be
Too
bit too
hot.
hot. So
Yeah.
5 p.m. to 11 p.m. is the sweet spot.
That's nice. Okay, sit on the boardwalk, have a drink, and then do a little shopping.
You can.
So it is pet friendly, right?
It is the
okay.
whole area is.
Amazing.
Yeah.
Kiss 92 traffic.
In the KPE tunnel towards the ECP before Airport Road, please avoid lane 1. An accident has been reported. Also on the TPE towards the PIE before Pongal Road, a vehicle has broken down. If you spot anything else, please be our eyes on the roads. It's 8855
Welcome back to The Big Show and The Big Show TV. You know, we've been chatting with this gentleman off air, and finally now you get to hear him on the radio. Nicholas Ionides is in the studio. He is the SVP for Communications and Corporate Affairs at Marina Bay Sands. Once again, welcome, Nick.
Thank you so much.
Thank you so much for coming in. So we were on the Big Show TV talking a little bit about the Sands for Singapore Charity Festival happening at Marina Bay Sands with while partnering the Community Chest. This is from the 5th to the 7th of September. I mean, if you missed that talk set, you can always head to our YouTube and Facebook and catch up on that. But right now we want to talk about this year's The Sweet Collective, because you have brought in a couple of boxes of these beautiful desserts, courtesy of some really great restaurants at Marina Bay Sands. So tell us a little bit more about that.
Well, we have some of the best chefs in the world at
You
Marina
do.
Bay Sands, if we may say so, and some of the best pastry chefs. So every year for the Sands for Singapore Charity Festival, we try to do things differently. Last year we had ice cream in our 10th anniversary year of the festival. This year we tasked our chefs with coming up with special tarts that we will sell, and all proceeds will go to charity. So this year it's called the Sweet Collective. So you're holding in your hand, Angel, the box with the 4
Oh, that's a
tarts.
great picture there.
Oh,
Yeah.
there we go. That looks fantastic.
Yeah.
So
For those of you who are watching us on Facebook and YouTube,
Yeah, you
that's
can
a
see that.
beautiful box we call the Sweet Collective.
yeah, so shall we describe them?
Yeah,
so
please.
Basically, these are from 4 of our signature celebrity chef restaurants. Cut by Wolfgang Puck. So the top left is what's Cut has put together. It's a pistachio tart. It is
nice.
beautiful. I have tried them all. I have to say.
Okay.
They are good.
Well, you're doing the vertical marathon. You can afford
I
it.
can burn it off. Yes. So it's a beautiful item. The bottom left is wakuda. So it's a cheesecake
wow.
tart with Japanese rice paper on top. It's just
So
gorgeous.
pretty.
It's gorgeous.
It's gorgeous and it tastes really good too. The top right is Sakura almond tart. That's from Origin and Bloom, our patisserie. It's gorgeous. It has amazing taste, sour cherry in there. It's just gorgeous.
And the petals are nice and pink, actually.
Yes, it looks
Yeah.
a bit white on the picture,
Yeah.
but they're very beautiful.
Absolutely, it is pink. And the bottom right is from Maison Boulogne. It's a chocolate buckwheat tart.
Ooh.
And that doesn't do it justice by calling it chocolate buckwheat tart. It does sound good, but just imagine adding salted caramel in there and salted
Oh,
caramel
wow.
mixed with this chocolate. It's heaven, really good.
And
So
it
you can have
looks
that as
like
your
it's got a
breakfast.
little like waffle, crispy waffle type thing on top as well, sitting on top,
Yeah.
which looks amazing. Okay, so where can we order these dessert boxes, and how do we collect them, and which charity is this supporting?
So pre-orders are available now. So
Online?
Online, yes. So it's $45 per box. Available from now until the 25th of August. That's pre-orders. And then collections are between the 1st and 7th of September.
Okay.
From the 5th to the 7th of September, those are the days of the charity festival itself. You collect at the charity festival at Origin and Bloom's booth.
Oh, right, okay.
Prior to that, if you want to collect beforehand between the 1st and the 4th of September, you can do so at Origin and Bloom's outlet at Tower 3
Tower
of the
3,
Marina
right?
Bay Sands Hotel.
Okay.
So to your question about proceeds, where they're going. So we work very closely with an organization called APSN Center for Adults. So all proceeds from the sale of these items will be going to them to support their vocational training programs. So that's for adults with special needs, and it helps them, equip them to lead more independent lives.
Oh, that's a great charity. Thank you so much.
What about dining in, let's say, at Marina Bay Sands? I mean, everyone goes to all these wonderful restaurants there. How can those dining support the cause?
I'm so glad you asked that question as well, because not everyone is able to go to the event plaza over those days if you're traveling or if you have other commitments. So over several weeks, we are also having, through 7 of our signature celebrity chef restaurants, certain dessert items that they have on the menu, some of their most popular ones. All proceeds from those sales will also be going to charity as well. So that's from the 10th of August to the 7th of September. Proceeds also will go to the APSN Center for Adults. So that's Milos, our new Greek restaurant, which opened in July last year.
We've been there.
We were there
Thank
for the
you.
opening, yeah.
Oh, it's beautiful, isn't it? I was there for lunch yesterday. Great. Coma has a special dessert as well. Maison Bouloud will have one. Mott 32, Spago, Wakuda, and Yardbird. So
We've
all
been
of those.
to all
We've been
those
to
restaurants
I haven't been to
already.
Wakuda yet, though. But
Oh,
yeah,
lovely.
I'm
Okay,
sure.
next
I'm
on
sure.
the list.
Okay.
Okay, so that starts after this weekend then.
That
It's from the
starts this
10th of
Sunday.
August.
That's right. Mm-hmm.
All right, fantastic. Brilliant.
Yeah, we'll talk, like you were mentioning Milos, they've got the Greek yogurt. Coma's bonsai, I've actually tried that.
That's really
That's
good.
beautiful. I think I had it for my birthday. Maison Bouloud's got their chocolate peanut turon. Mott 32, sweetened guava soup with sago and pomelo. Spago's got their spiky lemon. I'm assuming maybe a tart. Is that a tart? Yeah. Wakuda's got their Basque cheesecake with ice cream, and Yardbird has a
Yum.
maple bacon cupcake.
I want that.
Oh my gosh. a maple
Anything with bacon.
Oh, man, I totally agree with you on that one.
All right, Nick, before we let you go, anything else you'd like to put out there?
Just come down to the charity festival. It's such great fun. The vibe is just brilliant. It's great for families. It's great to bring a date. It's just really, really good activity. And for our staff, it is, our staff love to volunteer in the community. We've got 12,000 employees. Every time we have volunteering activities, they're oversubscribed. So in the lead up to the festival itself, our staff are doing a lot of things, but it's the festival itself where the great fun, it all comes together, and it just makes you feel good. You get educated along the way. So please come down.
Again, the Singapore Sands for Singapore Charity Festival is happening from the 5th to the 7th of September, partnering with the Community Chest, and it's going to be in the event plaza of Marina Bay Sands, which is where the Rainoculus is.
That's
Did I
correct.
get it right? Okay.
And it starts in the evening.
It starts from 5 o'clock, right? 5 to 11.
5 to 11.
Perfect. Bring your pets as well.
Brilliant. Thank you so much, Nick, for joining us today.
Thanks so much for having me on.
Wake up feeling good. The Big Show.